My name is Mary Virginia Coffman, a student in MUIH's NUTR622 course. This is a presentation of my cancer case study. I'm presenting a 52-year-old Caucasian male. He is happily married with 2 teenage daughters. His height is 5'10" and his weight is 177 pounds. At a BMI of 25, my client is slightly overweight. My client presented with a history of testicular cancer in remission. He was diagnosed in December of 2013, treated with chemotherapy through the spring of 2014, and declared in remission in April of 2014. He also presents with dyslipidemia, elevated fasting blood glucose, elevated blood pressure, and is slightly overweight. His cholesterol is controlled with atorvastatin 20 milligrams daily. My client exercises by walking 3 or more miles about 5 days a week for aerobic exercise. He does not perform strength or flexibility conditioning. He describes feeling weak and injury-prone. His wife provides the majority of the household food. My client describes a moderately to highly stressful life running 3 businesses, experiencing the concerns of his 2 daughters, and addressing what he terms the crisis of the day. He sleeps about 7 hours a night, which he considers adequate. At home, my client eats fairly clean food, with only 2 to 3 vegetables daily. Post-cancer, my client increased his water intake to about half his body weight in ounces daily. However, he travels to conferences and for work about 60 days a year and eats what is provided by the conference and at restaurants. My client describes preferring meals to be easily acquired. My client provided a report from his July 2017 visit with his oncologist, one of 2 a year he is asked to make at this point, 4 years post-diagnosis. Over his lifetime, the only formal diagnoses of disease he has received are of high cholesterol and cancer. Neither the higher blood pressure nor the elevated glucose have been diagnosed as hypertension or prediabetes. His heart rate was on the high end of normal, and the cancer marker alpha-1 fetoprotein has remained steady within a normal range since he was declared in remission. My client takes few medications or supplements. He takes atorvastatin to manage his high cholesterol and a single fish oil supplement because his daughter suggested it. In the spring, he treats his allergies with loratadine. The only nutrient-drug interaction is between atorvastatin and grapefruit, which my client doesn't eat. Atorvastatin potentially depletes CoQ10. Due primarily to diet, my client is at risk for several subclinical deficiencies that may have an impact on his various conditions. Per a Chronometer app reading of his dietary recall, my client's diet provides an inadequate intake of vitamins E, thiamine, pantothenic acid, and D, the minerals zinc, calcium, magnesium, copper, and potassium, and inadequate omega-3 fatty acids and fiber. Blood pressure is affected by potassium, zinc, calcium, vitamin D, slightly high sodium intake, and slight overweight. Low levels of zinc and copper affect immunity. Activated pantothenic acid is coenzyme A, which may positively affect dyslipidemia, energy production, and acetylcholine formation, which affects muscle activation. His dietary intake provides low antioxidant and anti-inflammatory benefits. Although willing to talk with me at this initial visit and eager to share his cancer story, my client expressed essentially no interest in changing his diet or behaviors. He feels his health is under control medically and his risk for disease is small. When I dug deeper, he expressed that his interest in nutrition includes having a better grasp of portion control and mindful eating. He especially considers food and eating to be a social community effort. My short-term priority goals are shaped by meeting my client where he is with longer-term goals to expand on his early efforts at healthy eating. I will offer to teach his family or a friend group a class in mindful eating. I will inform him about portion control with a Helping Hands portion guide and handout and the Harvard Healthy Eating Plate handout. I will then invite him to review the Institute for Functional Medicine's core food plan online, which is less restrictive than the cardiometabolic food plan. After the brief explanation of the CFP, I will invite him to increase his colorful vegetable intake and support this with the IFM Phytonutrient Spectrum handout. Further, I will recommend that he increase his vitamin and mineral intake easily via the Pure Encapsulations 1 MVM, which contains CoQ10. I will also suggest Nordic Naturals omega-3 fish oil and that he increase his weekly intake of wild-caught fatty fish such as salmon and mackerel. Finally, to increase his strength and flexibility, I will recommend a personal trainer. My biggest challenge came with determining the best way to engage my client with healthy eating to ameliorate or eliminate his metabolic risks and reduce his risk of cancer relapse.